Hello, my name is Maria-Elena Giner, and I'm a PhD student here at the University of Texas. My research focuses on the intersection between municipal infrastructure and public policy, specifically in the Texas border colonias. What are the Texas border colonias? Well, these are communities that lack water and sewer, as well as other amenities that most communities have. By 1995, 25% had no water and 75% had no sewer. These colonias are located here in the blue along mostly the Texas border. In these communities reside 300,000 people in almost 1,500 colonias. So what is the issue of not having water and sanitation? Well, mostly the issue is that most of these homes had outhouses and outhouses or cesspools. Now, we've all used outhouses and ranches or isolated state parks, but what happens when you use them in neighborhoods? Waterborne diseases start to proliferate in these communities because the outhouses and cesspools bubble up raw sewage in yards during rainy season, as you can see in this picture below. Waterborne diseases first are transmitted because kids play in these areas and they start to ingest fecal matter. The other issue is that because homes don't have sanitation or wastewater treatment, they don't use too much water because they cannot dispose of it. So personal hygiene starts to become an issue. Because of the lack of infrastructure, rates of diseases in border counties was much higher. As you can see in this graph, the rate per 100,000 population in Texas these are the rates, and in the border counties, these are the rates. For hepatitis A, salmonellosis, and tuberculosis, they're over 2 times the state averages. So you had a lot more people that were sick along the border. So what happened next? In the late 80s, these poor health conditions caused by not having wastewater treatment received international attention. And the state legislature in 1989, through the Texas Water Development Board, created a program. And over the next 25 years, almost $2 billion worth of infrastructure, water, sewer, and wastewater systems were built. So as an engineer working on a PhD in public policy, I am researching if these public funds made a difference. Did the public policy of creating a program to build water and wastewater infrastructure help the Colonia residents reduce the risk of waterborne diseases caused by the pooling of wastewater, as you can see here? How will I do this? Well, using mathematics and statistics for data gathered over a 15-year period, I plan on layering geographically information for the colonias clustered into zip codes. And I plan on looking at the hospitalization rates at the zip code level. I will analyze how these colonias clustered in zip codes changed over time as the utilities began to provide service. I intend to look at over 90 zip codes in 40 counties. So this is one facet of public policy and municipal infrastructure, assessing the impact. And here's an example of one county that I looked at. This is the incidences of hepatitis A. Here on the bottom, we have the years 1995 to 2015, and the cases per 100,000 residents. As you can imagine, the red are the residents that live in colonias and don't have water and sanitation. Their rates of hepatitis A are way above what the state average is, which is here in blue. As A huge project, $120 million project, was implemented in 3 phases. You saw the incidences of hepatitis A start to decrease dramatically, to the point that they went from 60.8 cases per 100,000 in 1995 to zero point 0.2 in 2050. That was a reduction of 99.6% over 20 years, but more importantly now, it meets the rate that's existing in Texas. This is important because it's important to understand why we invest in municipal infrastructure and what is the social cost associated with it. It addresses issues of equity and need. I hope you have found this informative and it will motivate you to get into engineering and/or public policy. Thank you.